Simon Beard is here from Healthcare Venues, and today on Beyond Warwick we're going to talk about all things compliance. Briefly describe what Healthcare Venues is all about and your role there.
Well, Healthcare Venues sits in what we consider the middle of the industry because we see that there's a general lack of understanding of how regulatory codes of conduct that guide sponsored meetings and events for healthcare professionals, not internal staff meetings, how they work. And we think we fill that gap. So we work with corporate companies, specialist agencies, and for hotels and venues, our assessment, training and listing are just part of how we help them work more effectively to create commercial advantage. So being a member of Healthcare Venues provides connectivity to this specialist segment. We provide monthly hints and tips, newsletters, compliance workshops, agency educational visits, and access to relevant LinkedIn groups.
And is there a typical day in the role of Simon at Healthcare Venues? What does your day or week look like?
Well, I don't think I have a typical day or week. Within the company, I actually have two hats, two titles. So I'm compliance consultant and also head of venues. So a general week would be create listings for the venues we're now working with, writing their compliance summaries, marking assignments for those that have gone through our venue healthcare champion training. I talk to agencies about their training needs and also about venues who aren't already members about the benefits of coming on board.
And are you based at home? Do you do all that from the office, or do you get to get out and about?
Well, yes, I've been working from home for about 10 years now. So before working from home became cool, so I work up in my study. But there's nothing more I like to do than to actually go out on site. I originally got into the industry because I just thought I didn't want to sit behind a desk. I want to travel, and getting into meetings and events meant that a good week is knowing that I won't be at home for 5 days. I'll be getting on a plane going somewhere. And yes, whilst getting the other end meant that my working day starts the moment I get off the plane, and it could be 24 hours long, it didn't really matter to me. It was just the excitement of
being in a different place, doing a different thing, so not stuck at your desk the whole time. So,
exactly.
So that's what you like doing best, getting out and about. What would you say you like least? What are your challenges?
Challenges, well, with over 200 codes of conduct, keeping on top of changes within compliance regulations and therefore the knock-on effect on company policies will always be a challenge. The biggest question we always get asked in our role as compliance experts, if you like, is why don't you have a website with links to all codes of conduct? Well, essentially that's a full-time job.
Yeah, why doesn't anyone have that? It's too big a beast, is it?
It's too big a beast, and it will be a full-time job, and company policies are not open source anyway. And whilst codes of conduct are open source, it's the company codes that company policies that actually direct the meetings and events which actually come out in the application of the compliance when it comes to the live meetings.
So all of that all of keeping a lid on all of that and trying to box it up in it and present it to people that need to know, that's the challenge. Always,
and it's the application of code that where the nuances lie will always be a challenge. It's based on codes of conduct, of course, but public perception always plays a big part as well.
How important do you think it is for a venue to have a healthcare strategy? Does it matter?
It absolutely matters. If you're in any kind of sales role, whether it be healthcare or not, if you want to win more business and retain that business, you have to have a strategy. But especially for sponsored healthcare professional meetings where rules and regulations apply. So to understand your clients and their pain points and provide solutions will always go a long way to delivering long-term relationships. But that's part of a healthcare strategy.
And to understand compliance, how important is it for venues to have staff, dedicated, knowledgeable staff, knowledgeable about healthcare compliance?
Well, I think it's huge. And in my view, it's what we're trying to do is change the narrative. It's so easy to say, tell us what you want, we'll do it. Anybody can do that. But to turn it around and say, right, before you say anything, I know compliance applies, I know your pain points, I can save you time because I can provide the solutions that you're looking for.
So I've spent time trying to understand your challenges, and I can be a resource rather than a supplier, I guess.
Yeah, you're seen as a partner rather than just another supplier.
What sort of roles could these dedicated healthcare compliance champions, if you like, what kind of roles can they play? How can they make sure that the venue is supportive?
Well, we train venue healthcare champions on property in the sales and marketing role and in the operations, so proactive and reactive sales. But compliance, when it comes to the live event, everybody has a role to play, from your front of house manager to back of house to your concierge to your catering manager. But you're not always able to train everybody on every industry, and especially not healthcare. But this is where within our training we say, look, how do you normally get that information across to other department heads? Well, within your banquet and event orders. So, have somebody that's in control of clients' compliance requirements for the meeting and make sure that that's provided within the BEO to the heads of department.
Yeah, I guess here at Warwick, we make sure that the sales team understand the inquiry stage. We make sure that the operations team, like you say, on the booking contract, all the information's there, so the people on the ground, as it were, understand that it's a healthcare event and that compliance applies.
Correct, yeah.
What are some common pitfalls maybe that are encountered when planning or even executing healthcare meetings with venues that maybe don't understand the importance of compliance?
Well, regulatory codes of conduct have sort of five key areas where it applies, but one of the biggest important areas where people underestimate is perception. Not just public perception, just perception in general. And let me give you an example. One of our training case studies, if you like, is around the use of the phrase award-winning. It's normally used in the advertising of restaurants and catering outlets, and having an award-winning restaurant is a big thing. But the perception of saying that within marketing materials might suggest to the general public that there's an award-winning restaurant like Gordon Ramsay in the kitchen. But context around that phrase is rarely given. It might be in the small print, but a lot of the time that award might be actually for sustainability or from a local newspaper. It's not about fine dining, but sales and marketing teams leave that context out. But it's done intentionally because what they're trying to do is create attention for the restaurant, but that kind of attention isn't the kind that healthcare meetings and events are looking for. I guess the sense checker for when you're asking clients is, would you be happy for the full arrangements of the meeting and event to be produced and presented in a national newspaper? They wouldn't necessarily want it known that they've been sponsoring doctors to eat in an award-winning restaurant.
Okay, I understand. So is that an example of when it's gone horribly wrong? Or have you got an example of where it's gone horribly wrong?
Yes, there's always case studies for everything, and based on my experience. But compliance is around being transparent, being open and honest, allowing bookers to make an informed decision. I've seen a few times where hotels have become unclassified, i.e. not star rated, but legacy websites and even their brand websites still advertise themselves as a 5-star hotel. Whilst the use of 5-star hotels isn't necessarily banned, company policies tend to avoid their use. So it's easy for a hotel to be placed on a blacklist by not telling clients that they actually are 5-star hotels. It's not so easy to come off.
Okay. So on the flip side of that then, I guess, have you got an example where understanding compliance has saved the day?
Yeah, absolutely. The use of venues known for their entertainment, spas and golf courses and resorts come under that bracket. And we had a a phone call from a hotel contact in a blind panic, because they decided within a very well-known London meeting venue that they would build a brand new spa. Well, that's how they advertised it, a full-blown spa with massage treatments and rooms. And they sent news of this to their client database by email. So this database included a healthcare and life science company who had booked 2 day meetings at that particular hotel, and it was for healthcare professionals. So on receipt of that flyer, they called to cancel both meetings because they wanted to avoid negative press. They didn't want their doctors to be seen in a place of leisure, for example, because they didn't know anything more other than getting this flyer. So knowing the hotel and this hotel contact, I said, right, okay, where is the spa? How big is it? How prominent is it? And he said, well, actually, it's really quite small. It's sort of 2 rooms at the back of the building, which we've made really nice with light music and candles and things like that. But it's just an extra facility we thought we'd provide our leisure clients. And I said, well, where exactly is it in relation to the meeting space? So he said, well, it's at the back of the building on the 1st floor. And I said, okay, your day meetings, knowing where your meeting space is, how does that impact their meeting and event? Because isn't your meeting space on -1 floor? He said, yes. I said, well, this is the context that you're not providing your client. So he's seen your information and made a snap decision because he's got no context. So I said, now I think you know what I'm going to say next. You need to phone your client and tell him the context around your brand new spa. So when he was told, and therefore realised that it wasn't going to impact the meeting because the actual meeting space has a dedicated entry going straight down to -1, they weren't touching and weren't going anywhere near the public spaces or the spa area. So he reinstated the meetings.
Thank you for your time today, Simon. It's been a pleasure.
You're welcome.